Good morning, students. Today we will be talking about the prevention and treatment of injuries. We have done part 1 and 2, and today we will be continuing with part 3. Let's take a look at the knee, and in particular the knee injury, and then I'm talking about the anterior cruciate ligament injury. This is a tear of the anterior cruciate ligament, and the anterior cruciate ligament is also called the ACL. That's the acronym. The ACL is one of the four main stabilizing ligaments in the knee. The role of the ACL is to prevent forward movement of the tibia from underneath the femur. This is an image of the knee indicating all four ligaments, and in particular we're looking at the anterior cruciate ligament. Together with the posterior cruciate ligament, these two ligaments are vitally important to the stability of the knee joint, especially in contact sports and those that involve fast changes in direction and twisting and pivoting movements. Therefore, a torn ACL has serious implications for the stability and functions of the knee and the knee joint, of course. Here is a torn ACL, and if we look carefully at the image, we can see within the image the red part, and this red part here is the part where the ACL is torn. Torn ACL injuries usually occur through a twisting force being applied to the knee whilst the foot firmly planted on the ground or upon landing. A torn ACL can also result from a direct blow to the knee, usually from the outside. For example, an opponent kicking you straight to the knee while you're playing soccer. An ACL injury usually requires surgery and can result in the athlete being out of a competition for 6 to 9 months. The symptoms of a torn ACL are, first of all, a lot of pain, immediate swelling, and the third one would be restricted movement, and especially the inability to fully straighten the leg. How do we treat this treatment? Well, first of all, by immediately stop playing. Second of all, applying the right treatment to the knee, and then of course seeking medical attention as soon as possible. Okay, so far I've spoken about the knee injury. Let's switch to the shoulder injury, and then specifically talking about the shoulder dislocation. The shoulder joint is the most commonly dislocated joint. In such an injury, the head of the humerus, the upper arm bone, is forced forward when the arm is turned outward and held out to the side. This causes an anterior dislocation. What are the symptoms? The injury is usually acute, caused by direct or indirect trauma such as a fall or forced abduction and external rotation. There is a sudden onset of severe pain and often a feeling of the shoulder popping out. The shoulder will often look obviously different from the other side, usually losing the smooth rounded contour. The patient will usually hold the arm close to the body and resist abducting and externally rotating the shoulder. There is usually quite severe pain associated with dislocation. This is a shoulder dislocation, and In this image, you can see the anterior side and the posterior side concerning the dislocation of the shoulder. How do we treat a shoulder dislocation? Immediate treatment for a dislocated shoulder has two stages. Firstly, to protect the shoulder joint and prevent further damage. And secondly, to seek medical attention as soon as possible. The shoulder should be reduced, put back in by a trained medical professional as soon as possible. So far, I've spoken about the knee injuries, I've spoken about the shoulder injury, and now I'm moving on to the nosebleed. Nosebleeds happen as a result of injury to the division between the two nasal passages, the nasal septum, which contains a high proportion of blood vessels. How do we treat nosebleed? Compression should be applied as quickly as possible to the soft area just below the bridge of the nose, preferably with ice to stop bleeding. It is important to lean forward as this facilitates the blood to run out of the nose. Leaning back may cause swallowing of the blood, which can lead to nausea and vomiting. During this class, we have looked at three injuries. We have looked at the knee injury, we have looked at the shoulder injury, and we have looked at the nosebleed. These three injuries are coupled to the prevention and treatment of injuries, and specifically part 3. Thank you for your cooperation and see you in the next class.